What symptoms will you experience with colon cancer? Belly pain, change in bowel habits such as constipation or diarrhea, blood in the bowel movements, black or dark colored stools, feeling weak or tired or low in iron levels, common with anemia or such as iron deficiency anemia. How do we diagnose colon cancer? If you have one or more of the listed symptoms, a colonoscopy is often used to look inside the large intestine. Cancers growing within the large intestine can be seen during a colonoscopy, and a biopsy, which is removal of a piece of tissue for examination, can be done, confirming the presence of cancer. How serious is my colon cancer? Once a colon cancer is diagnosed, the next step is to determine its stage. Staging is a system used to describe the aggressiveness and spread of a cancer. The stage of a colorectal cancer is assigned based on several things, including whether there are signs of cancer spread on a physical examination or a CT scan, the chest, abdomen, and pelvis to see if there's any spread. The appearance of the cancer specimen when reviewed under the microscope is another way to check the aggressiveness. Colon cancer stages include stage 1, which is cancer has invaded into but not through the entire abdominal wall. Stage 2, cancer has invaded through the entire wall of the intestine. Stage 3, cancer involves the lymph nodes, irrespective of the involvement of the wall of the intestine. And stage 4, the cancer is spread or metastasized to distant organs such as the liver or lungs. Earlier stages of disease, stages 1 through 3, are referred to as localized colorectal cancers and are generally treated with surgery with or without chemotherapy. Stage 4 cancer is called advanced colorectal cancer and is generally treated with chemotherapy alone. Some patients may benefit from surgery of the primary tumor prior to the treatment of metastatic disease, especially if the primary tumor is causing severe symptoms. How do we treat colon cancer? The treatment of colon cancer usually involves surgery, and it may also involve chemotherapy. The initial treatment of colon cancer usually starts off with surgery. During the surgery, the cancerous part of the colon and the surrounding tissues, which usually involve the lymph nodes, are removed. The lymph nodes are round organs that serve as filters for blood from the intestines within the surrounding tissue, and they are examined under the microscope to determine if the cancer has spread beyond the colon. In most people, the two ends of the colon can be reconnected immediately after the procedure. Now this can be done. If it can be done, it means that you will continue to have bowel movements normally through your rectum. In other cases, the colon cannot be reconnected during the initial surgery. This can happen if the surgeon feels there is a high chance that the reconnection will fail, or the tissues are inflamed and need time to heal. If this occurs, the surgeon will sew the colon and at times the small bowel to an opening in the skin on the abdomen. The opening is called an ostomy. It's a colostomy if the colon is sewn to the abdominal wall, or ileostomy if the ileum or small bowel is sewn to the abdominal wall. You will wear a bag or an ostomy to collect the bowel movements on the outer skin. The ostomy is usually temporary. The two ends of the colon can often be reconnected after a few months, and sometimes after the chemotherapy is completed. In other cases, you will need the colostomy permanently. Now, chemotherapy is a treatment given to slow or stop the growth of cancer cells, even after the colon cancer has been completely removed with surgery. Cancer cells can still be in your body, increasing the risk of cancer coming back. This is called a relapse or recurrence. In some people, chemotherapy can eliminate these cancer cells and increase the chance of cure. This type of chemotherapy is called adjuvant, which means that if it is given after the curative surgery, at which time all the tumor is removed, most treatments involve a combination of several chemotherapy drugs, which are given in a specific order on specific days. Most of the drugs are given into the vein, intravenously or IV, but sometimes a single drug will be recommended, which can be given in pill form. Chemotherapy is given for either 3 or 6 months, depending on the stage of the cancer. An oncologist will talk to you about your options for regimen and duration of treatment, as well as the side effects you may experience during the chemotherapy. Chemotherapy is recommended for most people with stage 3 colon cancer, which is spread to the lymph nodes, and some people with stage 2 colon cancer. Chemotherapy is not recommended for stage 1 colon cancer, which is cancer within the bowel wall but not all the way through it. Before you begin chemotherapy, it is important to discuss the potential risks and benefits of the treatment with your oncologist. How do you follow up colon cancer after your treatment? After completing treatment for colon cancer, it is very important to follow up with your healthcare team. You will need appointments on a regular basis for a few years to monitor for signs that cancer has recurred. A full colonoscopy before or after the surgery to evaluate the primary cancer and to look for polyps or other cancers is necessary. After that, a colonoscopy is usually repeated 1 year after the surgery, and if this is normal, then every 3 to 5 years thereafter. If polyps or new cancers are found, the schedule may be adjusted. Visits with your healthcare provider are usually scheduled every 3 to 6 months for the first 2 years, and then every 6 months for the next 3 years. Most visits include a discussion of how you're feeling and a physical examination. A blood test for a colon cancer tumor marker called carcinoembryonic antigen, or CEA, may be done at each visit. A computed tomography or CT scan is usually recommended once per year for at least 3 years in people who have been treated for stage 2 or 3 colon cancer.